Does alcohol make you less lonely? Dr. Payal Kohli is here to give us the research behind it. Thanks for coming in.
Thank you, guys. What an interesting topic.
Boy,
right?
Yeah, you think so?
Yes.
I really do.
Yeah.
So can drinking reduce the feelings of loneliness or can make you less social?
It can, in fact. And so we know that after the pandemic, we had this loneliness epidemic, right? We're all lonely. We turn to alcohol to numb our loneliness. And it does a really good job of that while you're actually drinking, because it turns off what's called the prefrontal cortex, which is where social anxiety comes from. It also releases chemicals like endorphins, which make you feel happy, which make you bond with other people. It releases dopamine, and it turns off anxiety. So while you're drinking with friends, you connect better and you feel less lonely. Have you guys felt this too?
100%.
Yeah.
Yes. Let me ask you this, though, because I need clarification. Loneliness, would we call that a health concern?
A huge health concern.
So
In fact, the Surgeon General called it a loneliness epidemic.
So you're telling me the prescription for this health concern is alcohol?
No, I'm telling you.
I put those two
I
together.
see what you're doing there. Yeah.
So when you sit down and drink that alcohol,
Yes.
in that moment while you're drinking, it works. It's causing a chemical reaction in your brain. However, the minute that alcohol wears off, you get a rebound loneliness, a rebound anxiety that's actually worse than your baseline, not to mention the effects on sleep, which can then make the loneliness and the depression and the anxiety worse, not to mention the effects in your relationship and your work. So you're actually, what you're doing is in the short term, you're feeling better in that moment, but you're actually creating a bigger problem and amplifying it more. And that's really what we've seen, is that people use it as a way to relax or unwind or numb themselves at night, but then the next day they actually struggle even more.
I knew it couldn't be the cure-all.
I liked where you were going with it. Okay, so with drinking in America actually on the decline, especially with the younger generation, the guidelines on how much we should drink can be kind of confusing. I'm scared to ask you what you recommend because you're probably going to say zero, but realistically, what do you recommend?
Yeah, so let's talk about all the different organizations. World Health Organization, no amount of alcohol is safe. That's what they've said. The American Cancer Society, none is best. If you're going to drink, keep it less than 2 drinks a week, because that's where we see that inflection point, both for men and women, increasing risk of cancer. American Heart Association has said, don't start drinking if you don't drink. You know that old saying, a glass of red wine is good for the heart. They have debunked that very clearly and said, do not start drinking if you don't drink. If you do drink, you want to keep it as low as possible. But the newest dietary guidelines, you know, that Dr. Oz and others have commented on, that's where things are a little nebulous, because they took out the numbers. They've taken out any sort of kind of number metric, and they say just keep it as low as possible. But in general, we say 0 is best. If you're going to drink, try to keep it less than 2 a week. And then you start to get into trouble when you're really getting more than 7 drinks a week.
So maybe along those lines, I think we all agree, like, you know, the least amount, the better.
Yeah.
I understand that too. I've been drinking legally for 30 years. I know, never do I think I'm doing something good for myself right now. Right? There's always a risk involved.
Right.
But some people are going to argue, you know, I never go all out. I never go too heavy. I only have a couple of drinks every day and I'm okay.
Yeah.
Other people say, well, I don't drink during the week. I just kind of hit it hard on the weekend. Are either of these approaches better than the other?
And my patients ask me this all the time, Drew. So I would say the first approach is better, because it's the dose of alcohol and how high it gets in your bloodstream. So these weekend warriors that go on these binges, and usually we call a binge more than 3 or 4 drinks for a woman and more than 4 or 5 drinks for a man in one sitting. And if you go on a weekend binge, that's actually worse for you. So having 10 drinks on the weekend is worse than having 1.5 drinks every day during the week. So I say, if you are going to drink alcohol, give your liver some time to detox it, and so keep the dose limited. And again, try to mix in the water and mix in the food, and so that the absorption of the alcohol, which is what causes the carcinogenic effects as well as many of the other effects, can really be reduced.
What is this language about a lifetime exposure? What is that?
So this comes from a new study that just came out. So they've never looked at something called a lifetime exposure. So when we ask people how many cigarettes they've smoked, we say how many cigarettes for how many years, and we multiply that together for pack years of exposure. Now we're looking at this concept of alcohol life years of exposure. So if you drank in college for 4 years and hit it hard every weekend, your risk is probably a lot lower than somebody who's drinking a little bit every day for the entire life, because when you multiply that together, that's higher. So this study looked at lifetime exposure of alcohol. It compared people who drank more than 14 drinks a week, which is kind of that 2 drinks a day, to those that didn't. And the ones that drank more than 14 drinks had a 25% increased risk of colorectal cancer and a 95% increased risk of rectal cancer. And so now, and we know alcohol is linked directly to 7 different cancers. So now we're talking not just about what you do every week, but what you do for your whole life. And the good news about this study is those people that went sober, it reversed that risk. So I would say the takeaway here is it's never too late to cut down your alcohol, especially as you're getting older. What we fear the most as we age, cancer, stroke, heart disease, dementia, right? We worry about these things. Alcohol is directly linked to each of these things in a dose-dependent fashion. So as good as it feels to have that drink and take that edge off that loneliness and feel like you're bonding with friends, just try to see if you can figure out substitutes or alternatives, because they did a study where they looked at exercise or doing painting or doing other types of social activities, and they had the same benefit without having the risks.
Do you consider yourself a weekend warrior?
No,
Okay,
I'm a
good.
lightweight. So, but I do, I mean, I'm like way below 7, obviously, but above 2. So this is really interesting. But I love that you gave, guidelines, because it's hard to say, don't do it anymore. That's, really tall order for some
Well, and it's an
people.
important part of us feeling good about ourselves. Culturally, we connect with each other. But for someone small like you, I would say maybe 1.5 drinks on the weekend if you can.
Are you a weekend warrior?
No, wait a minute. I feel like you extended this entire interview just to hear the doctor say live on TV for a small person like you.
Thank you so much.
And with
It
that,
felt
we wrap.
good. It felt
Dr.
good.
Coley, thank you for joining us. We're back with more 9 News Mornings after this.